Which factor has the greatest impact on the overall effectiveness of steam sterilization? A. The presence of organic matter on instruments. B. The volume of instruments in the sterilizer. C. The pressure of the sterilization chamber. D. The quality and moisture content of the steam. Answer, D. While proper loading, pressure, and cleanliness are important, steam quality and moisture content are critical in steam sterilization. If steam lacks adequate moisture, it becomes superheated, reducing heat transfer efficiency. This can leave microbial spores unaffected, leading to sterilization failure. Why must enzymatic cleaners be used at specific temperature ranges during manual or automated cleaning? A. To prevent excessive foaming and unwanted residue buildup. B. To ensure that enzymes remain active and break down organic material effectively. C. To neutralize alkaline-based detergents used later in the process. D. To kill bacterial spores before sterilization. Answer, B. Enzymatic cleaners are temperature-sensitive and usually work best within a range of 80 degrees Fahrenheit to 110 degrees Fahrenheit, 27 degrees Celsius to 43 degrees Celsius. If water is too cold, enzymes remain inactive, making cleaning ineffective. If too hot, enzymes become denatured, losing their ability to break down blood, fat, and proteins on instruments. What is the primary reason hydrogen peroxide gas plasma sterilization is not suitable for some surgical instruments? A. It cannot effectively sterilize lumen devices. B. It reacts with materials containing cellulose and degrades them. C. It requires excessive aeration time before instruments can be used. D. It generates excessive moisture, leading to corrosion of metal instruments. Answer, B. Hydrogen peroxide gas plasma sterilization is incompatible with cellulose-based materials, such as paper products, cotton, and some plastic coatings. These materials absorb hydrogen peroxide, preventing effective sterilization and potentially damaging the sterilizer chamber. Why should surgical instruments never be soaked in saline solutions before cleaning? A. Saline can promote the formation of bacterial biofilms. B. It causes irreversible corrosion and pitting on metal surfaces. C. It leaves behind a white residue that is difficult to remove. D. It neutralizes the effect of enzymatic cleaning solutions. Answer, B. Saline contains chloride ions, which can aggressively corrode stainless steel instruments, causing pitting corrosion. These pits trap organic debris and microbes, making the instrument difficult to clean and sterilize properly. What is the most effective way to confirm the sterilization of instruments with complex lumens? A. Use of a Class 5 chemical indicator. B. Verification of mechanical cycle parameters. C. Biological indicator placed inside the instrument lumen. D. External process indicator on the tray. Answer, C. Instruments with long, narrow lumens present sterilization challenges because air pockets can prevent sterilant penetration. The most reliable test involves placing a biological indicator, BI, inside the lumen to confirm whether sterilization conditions were adequate to kill microorganisms. What is the purpose of conducting a Bowie-Dick test in a pre-vacuum sterilizer? A. To detect the presence of biological contaminants in the chamber. B. To ensure that the sterilizer chamber can effectively remove air before sterilization. C. To test if the sterilizer can reach the correct pressure and temperature. D. To verify the effectiveness of enzymatic cleaning processes. Answer, B. The Bowie-Dick test is used daily before processing sterilization loads in a pre-vacuum sterilizer. It detects air removal inefficiencies and ensures that steam penetrates evenly throughout the chamber. If air is not fully removed, sterilization failures can occur. Why are ultrasonic cleaners commonly used in decontamination units? A. They use cavitation bubbles to remove debris from difficult-to-reach areas. B. They sterilize instruments before autoclaving. C. They serve as a secondary alternative to enzymatic detergents. D. They lubricate instruments to prevent rusting. Answer, A. Ultrasonic cleaners work by generating high-frequency sound waves, which create microscopic vacuum bubbles. These bubbles rapidly collapse, producing a scrubbing action called cavitation that removes debris from hinges, joints, and other hard-to-clean instrument surfaces. What is the most reliable method to prevent microbial growth in sterile storage areas? A. Using ultraviolet light disinfection. B. Keeping temperature and humidity levels within recommended limits. C. Sealing sterilized packages with adhesive tape. D. Using absorbent paper inside sterile packaging. Answer: B. Maintaining temperature, less than or equal to 24 degrees Celsius or 75 degrees Fahrenheit, and relative humidity, less than or equal to 60%, in sterile storage prevents the growth of bacteria and mold. High humidity encourages microbial contamination, while fluctuating temperatures may compromise package integrity. What is the ideal drying time for steam-sterilized wrapped instrument packs? A. 10 minutes. B. 15 minutes. C. 30 minutes. D. 60 minutes. Answer: D. Steam-sterilized textile packs should dry for at least 60 minutes to prevent moisture from remaining inside the packaging. Any retained moisture acts as a pathway for microorganisms, leading to sterility failure. What is the primary reason aluminum instruments should not be processed in strong alkaline detergents? A. Aluminum retains heat, making it difficult to sterilize properly. B. Alkaline detergents cause aluminum to corrode or discolor. C. Aluminum-based instruments absorb too much moisture during processing. D. The reaction between alkaline detergents and aluminum produces toxic fumes. Answer: B. Aluminum is highly reactive to alkaline solutions, causing oxidation, corrosion, and discoloration. This leads to damage and potential contamination of instruments. Why is it essential to allow steam-sterilized items to cool before handling? A. Prevents rapid condensation inside the package. B. Ensures that chemical indicators do not overheat. C. Reduces the risk of contamination due to condensation. D. Avoids burns to sterile processing technicians. Answer: C. Handling warm sterilized items too soon can lead to moisture forming inside the packaging due to temperature differences. This creates a perfect environment for microbial contamination, potentially compromising sterility. Which of the following best describes the function of a sterilization cycle's drying phase? A. Removes residual moisture to prevent microbial growth. B. Ensures instruments remain lubricated and protected. C. Helps the sterilization wrap bond tightly to instruments. D. Increases the penetration of steam into instrument lumens. Answer: A. The drying phase is critical in steam sterilization because residual moisture can lead to contamination. Instruments or packaging that remain wet after sterilization create an entry point for bacteria. What is the recommended storage temperature range for sterile surgical instruments? A. 10 to 20 degrees Celsius. B. 15 to 30 degrees Celsius. C. 20 to 24 degrees Celsius. D. 25 to 35 degrees Celsius. Answer: C. Sterile storage should be maintained at 20 to 24 degrees Celsius, 68 to 75 degrees Fahrenheit, to minimize microbial contamination risks and preserve the integrity of packaging materials. What is the best method to test the effectiveness of ultrasonic cleaners? A. Checking for visible debris on instruments after cleaning. B. Using a cavitation test strip or aluminum foil test. C. Measuring detergent concentration after each cycle. D. Running the cleaner with an empty basket and checking water temperature. Answer: B. Cavitation test strips or the aluminum foil test confirm that ultrasonic cleaners are effectively generating cavitation bubbles. Without proper cavitation, biofilm and debris may remain on instruments. Why should paper plastic peel pouches not be placed inside wrapped instrument trays during sterilization? A. Peel pouches can melt under high steam pressure. B. They trap moisture, leading to sterilization failure. C. Their presence prevents proper air removal during vacuum cycles. D. Peel pouches act as a secondary barrier to microbial contamination. Answer B. Paper plastic peel pouches trap moisture and restrict steam penetration, leading to incomplete sterilization. They should be placed standing upright in sterilizer baskets, not inside wrapped trays. Which of the following is an incorrect practice when handling sterile surgical trays? A. Stacking trays on top of each other for space efficiency. B. Transporting trays on clean, dry, and enclosed carts. C. Inspecting each tray for compromised packaging before use. D. Storing trays in a climate-controlled sterile storage area. Answer A. Stacking sterile trays damages packaging and increases contamination risk. Trays should be stored on open wire shelving or designated storage racks to maintain sterility. What is the most effective method to sterilize flexible endoscopes? A. Ethylene oxide (ETO) sterilization. B. Steam sterilization. C. Immediate use steam sterilization (IUSS). D. Liquid chemical sterilization, e.g., peracetic acid. Answer D. Flexible endoscopes are heat-sensitive and cannot undergo high-temperature sterilization. Liquid chemical sterilization using peracetic acid ensures proper sterilization while preserving scope integrity. What is the correct way to store surgical instruments after sterilization? A. Directly on metal shelves. B. In a temperature-controlled, low-humidity environment. C. On the floor if placed inside a clean transport container. D. Inside sterilization packaging with no further protection. Answer B. Proper sterile storage requires temperature control, humidity regulation, and adequate air circulation. Instruments should be placed off the floor and away from direct contamination sources. What is the most critical factor affecting dry heat sterilization? A. Exposure time and temperature. B. Humidity levels within the chamber. C. Presence of biological indicators. D. Type of packaging material used. Answer A. Dry heat sterilization relies solely on high temperatures, typically 160 to 180 degrees Celsius, and prolonged exposure times to kill microorganisms. Unlike steam sterilization, moisture is not a factor. Which chemical disinfectant is most effective against prion contamination? A. Hydrogen peroxide. B. Glutaraldehyde. C. Sodium hypochlorite, bleach. D. Alcohol-based disinfectants. Answer C. Prion, responsible for diseases like Creutzfeldt-Jakob, are highly resistant to standard sterilization. Sodium hypochlorite, bleach, is one of the few chemicals proven to effectively denature prion proteins. Why must rigid sterilization containers be completely dry before packaging instruments? A. Prevents container filters from becoming clogged. B. Avoids sterilization indicator failure. C. Stops moisture from promoting microbial growth inside the container. D. Ensures that vacuum cycles function correctly. Answer C. Moisture trapped inside rigid sterilization containers can lead to bacterial contamination and sterility loss. Containers must be completely dried before packaging. What is the primary purpose of an integrating indicator, Class 5? A. Confirms temperature, time, and sterilant exposure. B. Acts as a backup for biological indicators. C. Monitors mechanical function of the sterilizer. D. Indicates when sterilization pouches are dry. Answer A. Class 5 indicators measure all three key sterilization parameters, temperature, time, and sterilant exposure, providing a high level of assurance that items were sterilized correctly. What is the primary role of decontamination areas in sterile processing departments? A. Sterilizing instruments using low-temperature methods. B. Removing organic material and reducing bioburden. C. Sorting surgical trays for operating rooms. D. Conducting chemical disinfection of all medical waste. Answer B. The decontamination area is responsible for removing blood, proteins, and other organic matter to reduce microbial load before instruments proceed to sterilization. Why should high-level disinfectants, e.g., glutaraldehyde, be used in well-ventilated areas? A. To prevent rapid evaporation of the solution. B. To avoid buildup of toxic fumes that can cause respiratory irritation. C. To keep room temperature within sterilization parameters. D. To prevent the formation of biofilm on medical instruments. Answer: B. High-level disinfectants like glutaraldehyde and peracetic acid emit harmful fumes that can cause respiratory irritation and should only be used in well-ventilated areas. What is the minimum required time for flash sterilization of an unwrapped instrument in a gravity displacement sterilizer at 270 degrees Fahrenheit 132 degrees Celsius? A. 3 minutes. B. 10 minutes. C. 15 minutes. D. 30 minutes. Answer: A. Flash sterilization requires at least 3 minutes at 270 degrees Fahrenheit 132 degrees Celsius in a gravity displacement sterilizer. However, it is only meant for urgent sterilization of unwrapped instruments. What is the recommended method for sterilizing heat-sensitive medical instruments? A. Immediate use steam sterilization, IUSS. B. High-level disinfection using alcohol-based solutions. C. Ethylene oxide, ETO, sterilization or hydrogen peroxide gas plasma. D. Dry heat sterilization at 180 degrees Celsius for 30 minutes. Answer: C. Heat-sensitive instruments, such as fiber optic endoscopes, must be sterilized using low-temperature methods like ethylene oxide, ETO, or hydrogen peroxide gas plasma to prevent damage. Steam sterilization is too harsh for delicate materials. Which of the following factors can negatively impact the effectiveness of enzymatic detergents used in decontamination? A. Water temperature and exposure time. B. Presence of stainless steel instruments. C. Using soft brushes for scrubbing. D. The weight of instruments placed in the sink. Answer: A. Enzymatic detergents function best at specific temperatures, usually 109 to 140 degrees Fahrenheit or 43 to 60 degrees Celsius. Too hot or too cold water reduces enzyme activity, making cleaning less effective. Proper exposure time also ensures complete breakdown of organic material. When packaging instruments for sterilization, which of the following is considered an improper technique? A. Using chemical indicators inside the tray. B. Placing heavy instruments at the bottom of the tray. C. Overloading the sterilization pouch to maximize space. D. Using double-wrapped packaging for extended storage. Answer: C. Overloading sterilization pouches prevents proper sterilant penetration and can lead to sterilization failure. Packaging should allow for adequate air removal and steam penetration. Why should rigid sterilization containers be routinely inspected for damage? A. Cracks and dents can compromise sterilization by preventing proper air removal. B. They can affect instrument lubrication during steam sterilization. C. The weight of the container impacts the sterilizer's pressure settings. D. Damaged containers increase drying time during sterilization. Answer: A. Rigid sterilization containers with cracks or dents can allow microorganisms to enter or prevent proper air removal, leading to incomplete sterilization. Routine inspection is crucial for maintaining sterility. What is the correct method for preparing instruments with multiple parts before sterilization? A. Assemble the instrument and sterilize it as a complete unit. B. Disassemble the instrument, clean all parts, and package them separately if necessary. C. Use ultrasonic cleaning and then reassemble before sterilization. D. Place small parts inside a gauze wrap before placing them in the sterilizer. Answer: B. Instruments must be disassembled before sterilization to ensure all internal surfaces are exposed to the sterilant. Reassembling before sterilization can trap debris or biofilm, leading to contamination. What is the purpose of a Bowie-Dick test in sterilization? A. To detect the presence of biological contamination on surgical instruments. B. To monitor air removal and steam penetration in pre-vacuum sterilizers. C. To check for the presence of chemical residues after sterilization. D. To verify proper temperature distribution in a dry heat sterilizer. Answer: B. The Bowie-Dick test is specifically designed for pre-vacuum steam sterilizers. It ensures proper air removal and steam penetration by detecting air leaks or inadequate vacuum cycles. What is the main disadvantage of using ethylene oxide (ETO) sterilization in hospitals? A. It cannot sterilize heat-sensitive instruments. B. The process requires high temperatures, which damage certain instruments. C. It has a long aeration time due to toxic residues. D. ETO cannot penetrate lumens or small openings. Answer: C. ETO sterilization requires extensive aeration, up to 12 hours, to remove toxic residues, making it a time-consuming process. While it is excellent for heat-sensitive materials, its toxicity and aeration time limit its use. What is the minimum exposure time required for steam sterilization at 270 degrees Fahrenheit 132 degrees Celsius in a dynamic air removal, pre-vacuum, sterilizer? A. 1 minute. B. 4 minutes. C. 10 minutes. D. 30 minutes. Answer: B. Pre-vacuum steam sterilizers require a minimum exposure time of 4 minutes at 270 degrees Fahrenheit 132 degrees Celsius. This is shorter than gravity displacement cycles due to the vacuum process that enhances steam penetration. Which method is considered the most reliable indicator of a sterilization process's success? A. Chemical indicators. B. Mechanical printouts. C. Biological indicators. D. Integrator strips, Class 5. Answer: C. Biological indicators, BICE, containing live bacterial spores are the gold standard for verifying sterilization. They provide the most reliable evidence that microbial life was effectively destroyed. Why should lumen instruments be processed using extended sterilization cycles? A. To prevent instrument corrosion during the sterilization process. B. To ensure sterilant penetrates and effectively sterilizes internal surfaces. C. To remove excess moisture and improve drying time. D. To allow for additional chemical indicator exposure. Answer: B. Lumen instruments require extended exposure times because sterilant must fully penetrate the internal channels. Incomplete sterilization can leave residual bioburden inside the lumens, increasing infection risks.